watching the award-winning GHS TV, Germantown Community Television, your hometown news and information station.
Hello, I'm Gail Dorband, host of the Inside the News, and this is our second program this season. And boy, do we have lots of smiles for you today. First of all, we have Dr. Godat and our other doctors that are here to make sure that we have beautiful smiles. Pat Smith is here with us, and of course she has the beauty of nature and flowers for us. Dr. Arcott is going to do things about our veins, and because Dr. Godat is going to help us with our smiles with our teeth.
Television, your hometown news and information station.
We're back inside the news, myself, Gail Dorband, and my husband Bob with Dr. Godat. And you know, we're saying this program's all about smiles. I know puppies put a smile on your face, but
absolutely,
I know you put a smile on everyone's face. And you're our periodontist, lots of Germantown patients. Bob, you've been studying this periodontal work, and you've got the first question.
What exactly does a periodontist do?
Well, a periodontist is a dental specialist, and we deal with treating gum disease. We also deal with doing dental implants, and we do various cosmetic procedures to help improve the beauty of one's smile. We work very closely with your general dentist to do these various procedures that we do. So that's what a periodontist is, and periodontics refers to the gums and bone around the teeth, and that's what we're mainly treating and helping people to keep their teeth if we're treating periodontal disease.
Now,
so,
I know we have some visuals. I don't know what we have exactly first,
okay.
Mitch, so we're going to kind of look at that. But I know if you have lost a tooth from an accident or
right.
whatever kind of disease or
An
whatever.
abscess, infection, or things like that.
You
certainly.
have some different choices. I know you can. Now, here's something. This tells
Right,
a
this
little
is
bit about
just this is just a picture of our website, which is a great place to get some additional information on periodontics and dental implants and
Right.
stuff. And then the next picture is of our dental team that we have.
Will all those people be in your mouth at the same time?
All these people will not be in your mouth
right,
at the same
okay.
time. But
Because I've got a pretty big mouth, but I don't think I can even accommodate
Right.
that, Mitch. You know?
Well, one of the things that we really pride ourselves on, and one of these pictures you're seeing a picture of a digital screen, and we're able to digitally show people what we can and can't do to help them out.
Good.
And we can help them make decisions for their mouths to decide how they'd like to treat something and to get better. So that's one of the things we pride ourselves on, and working as a team to do that.
Wonderful.
So,
Now, what is this?
this
Now,
is
I understand is this laser?
This is a laser procedure, and many people have periodontal disease and don't realize it. Periodontal disease is a chronic infection. A lot of times people don't even realize that they have it. They may not have bleeding gums and loose teeth as you can sometimes with periodontal disease. So it can go hidden. It's very similar to diabetes or high blood pressure, where you go see a physician. You commonly don't realize that you have that. And it's important to treat periodontal disease not only to get your mouth healthy so you can smile and keep your teeth and chew and speak, but it's also been related to lots of other diseases. We have a cardiologist coming up next, and there have been lots of studies that have come out lately to relate the inflammation that's in our mouth. The disease infection in our mouth is actually affecting our arteries and increasing the chances of high blood pressure, atherosclerosis, and even stroke and things like that. So there's a lot of relationships between periodontal disease and overall health, including diabetes too.
Now, tell us about this, Dr. Godat.
Well, this is the laser procedure to treat periodontal disease or gum disease. This procedure is called LANAP, and my partner, Dr. Roger Craddock, originally introduced our practice to this about 5 years ago. We were the first practice to bring this technology to the Mid-South area. And this particular patient, he had very bad gum disease between his front teeth, and the space between the teeth opened up as a result of the bone loss he had in this area. In this particular situation, we utilized this laser procedure, which with conventional techniques, we would have usually lots of loss of the gum tissue. You might have a big open space after periodontal treatment. Your teeth might be very sensitive. The procedure sometimes could be quite painful, unfortunately. With the new laser procedure that we use today, The patients are much more comfortable, they don't have the root sensitivity, they heal much faster. In this particular case, with the help of an orthodontist to actually close the space between the teeth, we're actually able to allow this area to look natural again, as if we've never even done anything to that area.
That's amazing.
It really
so
is
that
amazing.
procedure, outside of putting braces on, this procedure,
You would have to have this procedure before you went through orthodontics. You can't have an unhealthy environment in your mouth and move teeth around unless you want to lose all your teeth after the braces are removed, and that's not what we want, certainly.
of course.
Now, do we have any more visuals that, here's
This is,
one.
this is another procedure that we do, which is treating what's called a gummy smile. Somebody may have lots of extra gum when they smile, and we can do procedures in our office called aesthetic crown lengthening, and we use another laser in our office called the VersaWave laser, and this laser allows us to remove the extra bone and gum tissue so we can show your teeth off. And we might work with your general dentist to do veneers and crowns on top of the teeth too. This particular case, though, we were able to treat without doing that. We were able just to remove extra bone and gum, and the beautiful teeth were revealed with that particular technique.
So in other words, we can enhance our smile.
Absolutely.
And that we couldn't before. I know another thing that you and I spoke about is just, you know, if you've lost gum tissue because you've tried to do root canals, you've tried to do other things, and just hasn't worked. You've done everything right, but it hasn't worked. You do have something that you can do to grow back some of this, and I don't know the technical terms
Well, there
of
are
this.
two things that you may be looking at here. One, patients may lose gum tissue around the roots of their teeth, and we can do soft tissue grafting to regrow the gum tissue back around the teeth. Another thing, in some situations, somebody may end up losing the entire tooth, and when you lose a tooth, particularly if it has a lot of infection, you may lose a large amount of bone and gum tissue, which we need to make teeth look like teeth. So that brings into play dental implants, and I think there's a picture of that.
Let's see that too.
We've got some before and after pictures of some patients who've broken off some front teeth. But we're able to regrow gum and bone tissue these days and then make something that looks like a tooth.
And that's amazing. How long has that been going on now?
That's been going on since about 1967, when a guy over in Sweden figured out how this particularly works, and then we've evolved over the years, and we now are able to do these procedures in a much shorter period of time. In some of the cases that we showed in the pictures, we're actually able to take a tooth out and maybe even the same day place the implant and have the patient leave with a new tooth.
So instead of having to do a bridge or having to cap teeth,
that's right,
you just have one tooth, which is wonderful because you don't have to damage the teeth around it.
Absolutely. You're exactly right.
It's not like Quickcrete for a tooth.
It's not like Quickcrete for a tooth.
And we don't want any Abraham Lincoln teeth.
And I think that's one of the big things. If we don't have to do treatment to other teeth, we're able to preserve those other teeth, and that can help you keep your teeth for a lifetime.
Well, and then you can also do a bridge. And,
you certainly can do a bridge.
But then you have to have two good teeth and kind of sacrifice the two good teeth.
That's exactly right. And then that may compromise those teeth to some degree. And bridges are still good. I still recommend bridges. I don't want to sound like they're bad. But dental implants have really opened up the opportunity to be able to replace teeth better in some ways and replace teeth where we couldn't replace teeth before. One of the picture examples we have is of denture patients. And denture patients, we all know, have routinely had dentures that flop around, have to use adhesives, they get denture sores, and with the advent of dental implants, we can use that to anchor dentures in place, and that works very well. We have many happy patients.
We're glad we have your website.
Thank you.
And we've run out of time, Mitch, Dr. Godat, and you know, go to Dr. Godat because he knows what he's talking about. Just stay tuned for Dr. Arcott, who will definitely put a smile on your face. So stay tuned for Inside the News. We'll be right back.
To the only station that puts you first, Germantown Community Television.